Well, I think before I do that, I have to give you a little bit of background about HIV and the disease it causes. So, when HIV infects a cell, it kills it, usually, and this can result in AIDS, and people will die. However, we have worked out ways to treat the virus and stop it growing. And if you take your HIV medication, you don't succumb to AIDS.
Introduction to HIV/AIDS. HIV, human immunodeficiency virus, is a virus that attacks the immune system, particularly CD4 cells, T cells, which play a crucial role in fighting infections. If untreated, HIV can progress to AIDS, acquired immunodeficiency syndrome, the final stage of HIV infection where the immune system is severely damaged, making the patient vulnerable to infections and certain cancers. Epidemiology of HIV/AIDS in the United States. Prevalence. As of the end of 2020, approximately 1.2 million people in the United States were living with HIV. Incidence. In 2019, about 36,800 new HIV cases were reported. Demographic distribution. HIV disproportionately affects certain communities, including men who have sex with men, MSM, African Americans, and Hispanics/Latinos. In 2019, 69% of new HIV infections occurred among MSM, 42% among African Americans, and 29% among Hispanics/Latinos. Risk factors. Sexual transmission. Unprotected sex with an infected partner is the most common transmission route. Drug use. Sharing needles with someone infected with HIV. Mother-to-child transmission. HIV can be transmitted from an infected mother to her baby during. Prevention. Condom use. Correct and consistent use of condoms can significantly reduce the risk of HIV transmission. Pre-exposure prophylaxis. PrEP. A daily medication for people at high risk to reduce the chance of contracting HIV. Needle exchange programs. These programs provide sterile needles to drug users, reducing the risk of HIV transmission through contaminated needles. Testing and counseling. Routine testing and counseling for HIV can aid in early detection and risk reduction. Treatment. Antiretroviral therapy, ART can control HIV, allowing those infected to live longer and healthier lives. ART also reduces the risk of transmitting HIV to others. Viral suppression. Effective treatment can suppress the virus to undetectable levels, reducing the transmission risk to nearly zero. Thanks for watching.